Motion to go into closed session pursuant to Minnesota statutes 13D.03 and 13D.05, subdivision 3B, for the purposes of discussing labor negotiations and attorney-client privilege information. I hear a motion.
So moved.
Second.
Second.
All in favor, say aye.
Aye.
Opposed? So moved. At this time, I will accept a motion to end the closed session and return to the open meeting.
Motion we return back to the meeting.
Second? Second. All in favor, say aye.
Aye.
Opposed?
Aye.
So moved. That's 4-1. I'll call the regular. No, not yet. All right, we'll move on to. Almost cut some people out here. Oh my gosh. Are there any new employees?
Nope.
Nope. Okay, how about future work meeting topics? Okay. Housing Trust Fund, RFP update. Jeff?
Good afternoon, Commissioners. I'm here again to talk about the Housing Trust Fund and where we're at with that. What was that? No problem. I'm gonna try and keep it short, so. Look, just a quick history. The money for the Housing Trust Fund, this idea started about a year ago when we got the local homeless prevention dollars. Just as a reminder, it's a little bit around $700,000 the first year. Second year is gonna be a little bit less. We don't know how, we'll have it for 5 years. We don't know how much we'll have over that time total. We also got another amount of money losing the local housing aid. That was also, we have 2 years of that at about $133,000 each. So we have a pretty good sum of money that we want to put into this trust fund. You guys already went through all that. You already have the ordinance in place. So the next process was putting together the RFP. We put out an RFP. I prepared it on 9/5 of 23. Submission deadline was 9/15 of 23. The objective of the RFP was to identify a holder, someone to hold and disperse the dollars that the county would be putting into this fund. We received two proposals, and the one that was the most complete was one from the United Way of Bemidji. We are currently working on a contract with the United Way. We hope to have that finished and to you in December. And we would hope that early in January, we would be moving forward with accepting proposals for the dollars. One thing I want to say is I am a United Way board member, so I did have a conflict with this. Because of that, my vote was not counted. And as we move forward, I'm not going to be in charge of this process for the county. It'll be Ann. Any questions?
Questions?
Who was the other organization?
Northwest Foundation.
Mr. Chair,
Yes.
as far as which of us are gonna be part of the overall board with the trust, where are we at with the process?
We're still waiting on the contract. Once the contract gets in place, we'll sit down with United Way. Actually, Ann will be sitting down with United Way and working through that to figure out who the actual board members from the county will be on it. And then there'll be other board members as well. In talking with United Way, they anticipate that they're going to have a advisory group that will look at some of the proposals and help move some of those proposals forward to the board to actually review.
Okay, Mr. Chair, I would be interested in being a part of that if, and just so you know,
I think
more to come on that, I know.
All those are gonna come before the board anyway.
Yeah.
Okay, thank you, Joe.
Thanks.
Anyone else? Thanks, Jeff.
All right, thank you.
All right, now we have the MDH Northwest District Epidemiologist.
Yeah.
Epidemiologist.
Good evening,
Okay.
gentlemen. I am not the epidemiologist, nor did I quit my job and get a new one. But I'm just here to,
You can't do that.
no?
No.
Okay. But I am here to introduce Sarah. This is Sarah Levitt. She's with MDH and she is our regional epidemiologist. So she is the person that we go to for our data, our questions, if we're getting a hand alert, all those kinds of things. So I will let her give you a little bit more of her background and her experience to why she is an expert in her role. But that's all I'm here to do is just to introduce her tonight.
Good evening, commissioners. Thank you for having me. Epidemiologist, it's a big fancy word, but basically what we do is we analyze patterns in health data, which makes that sound just a little less aggressive in that title. So in MDH, there are 7 regions in which there are what's called district epidemiologists, and we are the main liaison for the department and local public health, and we interface with them in disease investigations, but also other public health issues and needs, and try to work with them on any data that they need and what we can do to try to provide them with what they need. So what I'm going to go over is a big topic right now, which is opioid use. And it's actually been quite an epidemic and or topic for a number of years, but it's had some changes. And now with a lot of the counties in the state, across the state, looking at how to use their opioid settlement dollars, just want to give a picture for Beltrami County so you can kind of see where your data is at, but also some problems that are very specific to the region of Northwest and not just Beltrami County. So kind of just good to get that place of where your county stands and the region compared to the state. So this is what we're going to go over. Okay, so the Northwest, there are some different versions of Northwest. But it is based on the emergency medical system or EMS regions. So the Northwest is 12 counties and 3 tribes. All right, just to go over a little bit of terminology when we're kind of going through this data. So we'll have some non-fatal events. So non-fatal drug overdoses are overdoses that are due to drug use that do not result in death. And then you have your non-fatal overdoses that involve opioids, but they don't exclude other drugs. So we know that opioids were involved in the event, but we can't say that other drugs were not. So it's very common for more than one drug to be present and or used to coincide with other drugs. So I just want to make sure in the non-fatal world, we're talking about that. And then when we talk about more fatal events from overdoses, we're talking about ones that are due to all drugs. And then we're talking about ones that are specifically involving opioid as well. So just kind of want to run through that a little bit. The good thing about our hospitalization data is it also includes our hospitalization data from our North Dakota partners. We know that a lot of systems in the Northwest, those health systems cross over into North Dakota. So it's very important to be able to provide North Dakota hospitalizations in addition to Minnesota so that we're not missing our residents who may receive hospitalizations in North Dakota. All right, just to go over a little bit about this epidemic. It's been going on since the mid-90s, but has taken some twists and turns. So opioids are a class of drugs that are used to treat pain. You have your prescription opioids. These are your most common types of opioids that we talk about now in terms of the epidemic. And then you've heard of fentanyl. That's a synthetic opioid, a very strong one, but also a pain reliever. It can be both legally made and illegally made. And then we have heroin, which is probably what was talked about in the mid-90s to early 2000s. That's when we heard of most, which is illegal opioid. So this particular epidemic began in the 1990s with prescription opioids, overdose deaths, from natural and synthetic opioids. We started to see an increase in those about 1999. Overdose deaths involving heroin began to increase in 2010, and then more significant increases we began to see with fentanyl and some of the other synthetic opioids in 2013. So just we're going to make our way down from the national to the state to the county and to the region so that we can see how all of these trends are actually aligning together. So in the national perspective here, the rate of overdose deaths remains high. In 2020, opioids were involved in more than 68,000 deaths. That's 8.5 times the number of opioid-involved overdoses in 1999. So we know it's increased from our past trends. Drug overdose deaths increased by 30% from 2019 to 2020. So that's a pretty large increase from one year to the next. In Minnesota, just to give context, we hear a lot about opioids, but we want to know a little bit more about what the most common drugs are when people present for treatment. It's actually alcohol, but alcohol is actually used in conjunction most often with other drugs, but it still remains the primary drug that is present when people are admitted for substance use disorder treatment. So at the point of treatment, alcohol is still the primary. Then we have methamphetamines, and then we have our various opioids. So just to give a context for some of the other drugs so that we don't kind of keep out of sight what also people can have substance use disorders from. In Minnesota, we have a tracking system for reported opioid prescriptions dispensed. This is a good system because it allows us to see that we're actually decreasing in the amount of prescriptions that are dispensed. And one of the biggest ways that opioids get into the hands of both children, adults, is actually from somebody who might be legally taking them for a reason that they're able to get them. So that's called diversion. When a prescription medication is taken by someone, it's not prescribed to. So that's what we see a lot. So reducing the number of prescriptions helps reduce opioids from getting into the hands of others in a home and or outside of the home. Just to give a little data, this is from our Minnesota student survey. This is done in conjunction with the University of Minnesota. This is a question on opioid use among youth. So the red line is 8th graders, that green line is 9th graders, and that blue line is 11th graders. So you can see the percentage of 8th and 9th graders, which are your younger, just coming out of middle school into high school, who reported inappropriate use of pain medications, OxyContin, Percocet, Vicodin, within the past 12 months has continued to increase. So drug use or experimental drug use is most common in those earlier, younger ages. You see, as students get older in the high school age, you start to see that drop and level out. So those are high schoolers that are about to start to leave high school. They might have other decisions to make, entering the workforce, so that can sometimes change whether or not they continue to experiment with drugs. But obviously our younger youth reporting inappropriate use, and that is continuing. So these are non-fatal emergency department visits. So emergency department visits are different than hospitalizations. So this is going to be an important trend to look at when we get to some of our other data with the region and the county. So that top blue line is all opioid use. That green line is opioids excluding heroin, because heroin is a different opioid. And then that red line is for heroin. So you can see that non-fatal emergency department visits for opioid involved overdoses has actually been increasing since 2018. That increase has been driven by overdoses in the legal opioids or prescriptions. So just note that blue and that green line taking that increase. So now when we look at the Northwest region of Minnesota, those 12 counties, and we look at non-fatal hospitalizations, which are a marker of what happens when substance use rises to obviously a bad event, you can see that it's following the same lines. So you can see since about 2019, you start to see that blue line, all opioids going up. That green line, opioids excluding heroin. It's a lot of your prescription opioids. And then that red one leveling out. So it mirrors the same thing as the emergency department visits for the state. So you can see opioid involved overdoses more than doubled from 2019 to 2021. This is just a look at all of the counties together for hospitalization. So between 2016 and 2022, so there's only half of 2022 in this. And as soon as I have updated data, we will refresh that and then send that to you. So you can see that Beltrami, Mahnomen, and Polk County have the highest number of hospitalizations, non-fatal hospital visits for opioid involved overdoses. This is just to give you some perspective But if you look at the very bottom on the total, which is really the goal of this, as you can see where those larger numbers are since 2020. All right, so looking at Beltrami County specifically for non-fatal, we're going to look at all drug and opioid involved overdoses. So that blue part of the bar is all drug overdoses, and that green part is opioid involved overdoses. So if you look from 2016 to 2018, it's a 3-year period, there were 105 opioid involved visits. In 2019 to 2021, there was 218. So in the next 3-year period, there was a 108% increase in opioid involved overdose visits. So if you look all the way from 2016 and you were to just follow that trend all the way up to 2021, it's an increasing trend. And then 2022, that's half a year. So that tells you where you are with half the year there. And then when you get a full look at 2022 and half of 2023, that will give you a picture of where that trend is continuing to go. So if we look at the age groups for non-fatal drug overdoses, you can see that the 25 to 34 years old is your greatest number. So these are a lot of working adults. These are a lot of family adults. This is also the most common age at which women have children. So looking in that 25 to 34, now this is for all drug use. When we move to opioid involved, now you can see where that 25 to 34-year-old age group stands out even more. So this gives you an idea of an age group that is going to be a good thing to target in terms of programming, in terms of services, and finding out where you can reach that particular population. Not that it's not important across all, but when you're trying to get the most bang for your buck, you want to try to narrow down those places where you can really target certain populations or age groups. So then if we look at all drug and opioid involved overdoses by gender, we see that females are actually slightly higher than males for opioid involved in all drug overdoses. So that gives you the picture over time that females have slightly higher rates of drug use than males. This is not the best graph right here, but I wanted to include it because the trend with females is one that is across the state. So those top 2 lines, that green one is females age 15 to 24, and that blue one is the 25 to 34-year-old females. And you can see that those 2 lines are way above the other age groups for females. So there has been an increase across the state in non-fatal overdoses, that's for all drugs, among females. So in the Northwest, when we're looking at non-fatal hospital visits by race and ethnicity, American Indian and Indigenous people and white non-Hispanic make up the largest 2 populations in the Northwest. However, there are other smaller pockets of populations, but just to give you a perspective of where even if you have 1 or 2 in smaller numbers, they can still make their way onto the graph. So for Minnesota, if we now start to look at our more unfortunate fatal drug overdoses and the disparities associated with those, in 2021, American Indians or Indigenous people were 10 times more likely to die from a drug overdose compared to whites. And in 2021, Black Minnesotans were 3 times more likely to die from a drug overdose compared to whites. A lot of this also has to do with access to services. We know that differs across the state and many regions. When looking at the Northwest, if you look at that yellow bar, so those first 6 counties, they comprise 93% of all hospital visits for opioid involved overdoses in Northwest Minnesota. So Beltrami, Mahnomen, Polk, Clearwater, Hubbard, and Pennington alone, out of 12 counties, make up 93% of the visits. Beltrami County alone comprises 51% of those hospital visits. So for Minnesota, you can see the trend. These are opioid-involved overdose deaths. So now we're at the most severe outcome of drug use. And you can see that sharp increase from about 2018 all the way up to 2021. So it had sort of been on a steady incline, and now we're taking a sharper increase. So opioid-involved overdose deaths among Minnesotans increased 43% from 2020 to 2021. The number of deaths more than doubled from 2019 to 2021. So that was for Minnesota. Now, if we look at Northwest, same 12 county region, we see that same sharp increase. Where if we just go back real quick to this, the Northwest mimics the same pattern in deaths due to opioid-involved overdoses as the state. So it means that same pattern that's continuing in the state is also continuing in Northwest Minnesota. If we look at all of the counties together, so at the very top, you have the Northwest. So the green is the opioid-involved overdose deaths, and then the blue is all drugs. They're not separate. That green is what portion of the all drug or of the blue bar really make up deaths that involved opioids. So you can see that Beltrami, 58% of overdose deaths involved opioids. For the region, 54%. And you can see where the counties might differ on what portions of overdose deaths involve opioids. Then if we look at Beltrami County specifically, if we look over an 8-year period, so deaths, just because they're your most severe indicator, are usually going to be smaller, but they're still significant. So over 8 years, there was 21 deaths involving opioid use. Just over a 3-year period from 2019 to 2021, there were 34. So when you have 21 deaths in an 8-year period, but you have 34 in a 3-year period, that's an indication that a problem is reaching a very severe level very quickly. Neonatal abstinence syndrome is what happens when a woman is pregnant. She takes drugs during pregnancy, and those drugs pass through the placenta, which is the main form of how nutrients go from the mother to the infant. And the baby becomes addicted to drugs along with the mother. This is usually treated at the hospital after birth. Most babies get better within a few days to a few weeks, but they can be hospitalized for 3 to 4 weeks or longer, depending upon the impact of the addiction. Also depending upon how long mother has been taking drugs and or other drugs present as well. So they can be long hospitalizations and they're extremely expensive. Problems can develop among children. We don't usually see these until about 6 years of age and older. So then it's hard to tie it back to what would have happened at birth, but they can have long-term developmental problems with hearing, vision, learning, and behavioral. And then these are what schools might see a little later on. So in Minnesota, this is not the best graph, but just to give you a perspective on that very last year for 2021, Northwest Minnesota only makes up 13% of all cases of NAS or neonatal abstinence syndrome. However, as we go to the next graph, they have the highest rate of all regions in the state. So Northwest Minnesota has a smaller number of births compared to the other regions, which contributes to its impact. Because this is a per 1,000 live birth, not a per population rate. So that because this is something that's diagnosed at birth, that's why it's per 1,000 live births and not per 1,000 or 100,000 population. So if you look at those blue bars, those are the count. The gray squares at the top have the counts for the NAS diagnoses. And then that green line is the rate per 1,000 live births. So it's definitely a trend that's continuing in the Northwest. So even though Northwest Minnesota had its highest number of births since 2016, it's still remaining in that high category of NAS per 1,000 live births. So if we look over a 5-year period, a 5-year rate, you can see the Northwest region at the very bottom. And you can see Beltrami County, Clearwater, and Mahnomen had the highest 5-year rates of neonatal abstinence syndrome. So if you look at Mahnomen and you say, wow, that's like almost double the rate of Beltrami, does that mean more women are using drugs during pregnancy? It's actually the opposite. So Mahnomen County has less than 100 births per year, and that's why their impact is so high, is a smaller number of births. Beltrami has the largest number of births in the 12 out of the 12 counties in Northwest Minnesota. Any questions? Sorry to depress you, but yeah, that's my job sometimes.
Just had one quick question. You
Yeah.
showed 8th and 9th graders earlier, but then when you showed the numbers, it all started at age 15. And that's our, we'd assume that there aren't any 13, 14-year-olds that are getting, having overdose issues.
Well, they're just not captured in the survey because of when the age group starts.
Okay.
So yeah, we don't want to assume that younger kids aren't. This probably just right when the cutoff is. It's very common to start at 15 for lots of the youth stuff, kind of like teen pregnancy. You can see them below the age of 15, but 15 is the most common age at which a lot of those surveys start. Yeah, but it definitely does exist below that.
With the numbers that you showed for 8th graders being high, I just thought maybe they should start the numbers at least at 14, if not 13.
They actually should start them at probably about 11 or 12.
Yeah.
Because that's the same thing that we see with the smoking data.
Okay.
So if you think about the smoking data shows that kids are actually more likely to start around the age of 10 or 11. It just tells you with a survey like this that they need to broaden how they capture that so that they can capture younger groups and not just stay at that. Yeah, it's a
Thank
great
you.
question. No.
Sarah,
glad-
this has really been interesting and eye-opening, but I think another thing we'd probably benefit from is to know what is being done and what is suggested, the best practice of helping to confront this another time. So I won't ask that question right now because we're kind of running into our next meeting.
Yeah.
Tim, you wanted to,
Yeah, Mr. Chair, this is a good, interesting conversation, the statistics are alarming and it's something that I see, especially in my community. And it's sad because, you mentioned 34 deaths, it's 34 families that are really impacted by this.
Right.
I wish that we did have more time and I'm hoping that Amy would come back sometime with give us some more information maybe, because I'm kind of curious what we can do, as a county or maybe as a board member, to try to help educate or things like that. And I think another thing that I think is important is, you mentioned the 8th, 9th, and 11th graders. And what concerns me with that age group is vaping and how vaping might be easily accessible to them and things like that. So again, it's another time for another topic. So thank you.
Absolutely. I did provide some, they're free, but they require some work, some ideas for collaborations for the maternal and child health world. And then it sounds like Beltrami County is on a good track with some programs that you have. So possibly expanding those as well. But yeah, Amy will talk more about that. But thank you for having me. It's a pleasure to serve rural Minnesota in my state position.
thank you very much. Okay, I think what we'll do is adjourn this meeting and in 2 minutes start the next unless we have some other need. We move right into the next one.
My break.
Okay. All right, we'll start the regular meeting with the Pledge of allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, do we have any citizens here addressing the board that would like to address the board? Okay, seeing none.
Mr. Chair, I move that we accept the agenda with the additional item of 10A for the administrator's update.
Okay, is there a second?
Mr. Chair, I will second that with an amendment to the agenda. And I would like to, I'm looking for it here right now. Oh. Let's see on my phone. 7K. And that would be the human resources approval of job evaluation ratings.
And put that as 11, or put that as, maybe put that as
10A.
10.
We make that 10A and then.
You have the,
Yeah, we'll do that. 10A and administrative report will be 10B.
Yep.
Okay, there's been a motion made and seconded. Do you? accept-
Mr. Chair,
Yes,
I'd like to amend the motion to include redistricting lawsuit decision as the last item of new business.
so again, we're back to how to vote on this.
We needed to get approval from John. Did you approve the amendment that Jim made?
I did.
Okay. So that's the original motion and amendment, and now we've got a motion from Joe to amend it further. So is anybody seconding that?
Hearing no second. We go back to the first two.
So, Mr. Chair, let me just restate that we'll approving the agenda, the motion is to approve the agenda with the addition of 10A being the human resources approval of job evaluations rating from the consent agenda, and item 10B being the administrator update.
Okay. Do you agree with that second?
what, yeah,
Yes.
okay, yeah.
All in favor, say aye.
Aye.
Opposed? So moved. All right. Let's take a look at this. Do we have?
So,
approval?
Mr. Chair, I move that we approve the consent agenda as written, except for item 7K, which was moved to the regular agenda.
I'll second that.
All in favor, say aye.
Aye.
Opposed? So moved. All right, then we go on to resolution of support for Bemidji Area Cross Country Ski Club Grant. Dick is in charge.
Good afternoon. I'm here in front of you today with the resolution for the Bemidji Area Cross Country Ski Club. They would like to see a resolution to support them applying for a grant to build a new facility to store their grooming equipment and grass cutting equipment and everything else. Their current facility is a spot where I believe they're gonna have to move out of in the near future. And they'll be applying for a grant. And there won't be any county funds expended whatsoever. We're just working in collaboration with them to find a spot either on tax forfeited property or county owned property. We've got one spot that looks pretty promising and we're gonna pursue that, but it's essentially a resolution to support them applying for a grant to be able to build a facility on Beltrami County owned land or tax forfeited land. And we've got 2 representatives from the Bemidji Area Ski Club if you want any more details or need any more details.
Mr. Chair, I move that we approve the resolution to support the Bemidji Area Cross Country Ski Club applying for grants to fund a building for equipment storage on tax forfeit or Beltrami County owned property.
Is there a second?
I'll second it.
Discussion?
Mr. Chair.
Yes.
Dick, does this ski club help maintain the trails during the winter months and throughout the year or
Pardon, I think I missed the first part. Were you
does
asking about
the
what,
ski club,
what the
uh,
equipment?
do they help with grooming of the trail or how are they involved with your department?
Well, they groom all the trails.
Okay.
Our department doesn't do any grooming of the trails. But just to give you a wide variety, they also cut the grass out there before the season, you know, to make it a little bit easier to groom during the season. They can speak much better than I can on it, but so they've got snowmobiles, they've got the grooming equipment that's towed behind the snowmobiles, they've got grass cutters, and they've got quite a few things, and they're usually out there a good part of the year, taking care of the trails, cutting down, blow down and all that type of stuff. So
So with all that being said, it seems like a no-brainer to support
yeah,
something like this.
yeah.
Yeah.
Thank you. And when a county commissioner says it's no brainer, I would like to remain silent for the rest of the discussion here.
Anyone else? For you 2 folks that came here tonight to support it, thank you for all that you do. It's well appreciated.
It would not be successful or work the way it does without them, that's for sure.
All in favor, say aye.
Aye.
Opposed? So moved. Thank you, Dick.
Thank you. And next up, I guess I'm next up on the agenda also.
Yes, you are.
Again, this, you know, I've been before you before on encroachments and trespasses and such. This is a situation, and I don't know if Diane can put the survey up on the screen just to kind of help you see it. I know you can see it on your monitors also. But what we've got is a situation where you have to go a little further down if you would, please. The property boundary goes right through a house and a garage. And then also, if you go to the north, there's a bridge across the river, which was done correctly back in the day. They had all the permits, they had everything. They thought they put it on private land. Lo and behold, it's not on private land. So I'm here before you to take the first step in hopefully selling this property to them on a private sale, because we don't want the bridge, and it does go right through an existing house and cabin. And also, we're gonna reserve a easement that goes down the road and cuts off the road, and we've got all that surveyed and everything, so we can access some tax forfeited land to the west there, so it does benefit us in that respect. The owner would pay for the whole survey and everything, so the only money we might actually expend on this is we're gonna need an easement on a road just north of there for a few hundred feet, but that's it. So we would really be spending a minimal amount of money, gaining access, resolving one of these situations again. And that's kind of where, this is a first step. We'll have to come forward to the board again with when a price comes forward and to set it, or a value and a price, a date comes forward for the sealed bid also.
Yes.
I
Craig?
have a question, Dick, does this happen? So the public especially watching, did this, from our remonumentation project to where we get more accurate land, is that probably a result of why this is the way it is?
Yep, that
So-
would be my best
And,
guess.
you know, so the monuments, when they did the original survey, maybe they weren't going off of an accurate monument, and that's now that we have accurate monument locations, the survey lines are different, and so it wasn't necessarily an intentional thing from the landowner or anybody. It's just a, you know, so now we're correcting it.
I don't believe it was intentional. I think one of the things I've stated before is it gets a little frustrating when they do have quite a bit of acreage, and yet they tend to put things out on the border of what they probably could be a little more conservative. But yeah, essentially that's what we're running into here.
Thank you.
Anyone else?
I'd make a motion that we approve and moving forward with this.
Is there a second?
I'll second.
Discussion?
Just to let you know, this is to go send it to the state of Minnesota, which has to approve
Correct.
all land sales.
And
Yeah.
then it'll come back to us.
Yeah.
Mr. Chair,
Tim.
Dick, do you know how many more of these we have out there?
Well, I've only got 6.5 months.
Well, you ain't
before
gonna be able to
retirement.
retire until we get this figured out.
I've got a list yeah. They keep popping up, to be honest with you. But there's gonna be a handful more that are out there that keep popping up.
Like I said, you're gonna have to push that retirement date out.
The known ones and the unknown ones that are coming up. So, yeah, but thanks for your support. It isn't the most, it's certainly not the best part of my job having to deal with all these situations, but
Okay, all in favor of this, say aye.
Aye.
Opposed? So moved.
thank you.
Okay, I'm trying to get you all to your, all right. All right, we go on to the 7K, Human Resources Approval of Job Evaluation Ratings.
So, Mr. Chair, I asked that we move it from the, consent agenda because reading through the agenda bill, some of the things that I read, kind of concern me or kind of alarm me. I understand that the pay equity law mandates us to do this. So my question is, seeing that there's 19 so far in 2023, and there were only 18 in the past 2 years or 2 years prior, what's the reason for such a request, and how are requests made? And I know it's a loaded questions, but yeah.
Yeah, so for how a request is made, so it's in the personnel rules on how the process is laid out. But essentially, the supervisor department head would fill out a PAQ to go through the different job analysis. Well, it's a questionnaire, and then they answer it as to what they believe the position is doing as far as duties, the complexity, the skills required, education, training required for that position. And then what happens is the county administrator, myself, the HR director, as well as the department head will meet and talk about the position and to determine if we do push it through to Baker Tilly. And some main things we think about are when there's added job duties, just because there's more job duties doesn't exactly always mean that the position needs to be reevaluated. We have to look at, like I had mentioned, the complexity of the duties, the load. For some of these tonight, the ones that were pushed through, for instance, for the social services director, he has now double the amount of staff that he had when his position was originally evaluated. So they added 35 employees to his plate. So that's a substantial change to the job, which would cause us to want to reevaluate his position to make sure he is being paid appropriately, or not paid, I shouldn't say that, but he falls appropriately in his pay scale for his grade.
Okay.
So, what is the cost for Baker Tilly to do this kind of scale? And
Yeah, so each one that we send in, I don't have the exact cost, but it is 400 something. So it's $400 per job analysis that we send into Baker Tilly, and the department does have to pay. It does come out of the department's budget.
okay, that was my next
Okay,
question.
And this is relatively new. In the past, as we have kind of worked with Linda, and the decisions were made to send it forth, it didn't cost us anything. But in today's time, now it's 400 plus.
So I know that there are other companies out there that do the same or similar work. Are we getting the best bang for our buck? And
So it kind of ties back to when we did the original analysis, because they use their metrics for their SAFE system. I think I might have mentioned that in here. So it uses the same metrics that were initially developed for the position and the grading initially. And then it reevaluates on those same metrics. One thing I will note about that is since it has been such a long time, Baker Tilly themselves have changed their metrics. And so the old metrics that were used originally for our jobs has been changed, which can impact when we send them in. So it's just a little bit of extra hand holding when that does happen to make sure that it's still looking at the same type of metrics. It's just their scale itself has changed. So it can cause a little disruption that way.
Okay. Well, it's good to hear that there is some sort of process in an employee's ability to request, because $400 does seem like a lot. There was another, I lost my train of thought. If somebody else has a question, I'll come back.
John?
And can we see what the 23 budget impact is? Do we have an idea what the 24 budget impact is and what that does with our budget for 24?
I'm not quite sure I understand the question.
So on the notes that we've got, the budget impact for 2023 was $6,200, and there's only a month and a half left. So what's the impact for 24's budget?
I
And
don't
we're,
have the exact numbers for that, but it's definitely something that I could obtain for you guys.
and then how does that factor into that department's budget?
Yeah, so I kind of talked about that a little bit into the each individual position, the cost savings that they'll see that were mentioned carry on to the same cost savings in 2024.
Mr. Chair, wait, with those cost savings, aren't those only temporary though? I mean, like I was looking at the finance director, and they're getting a grant from the state. So how long is that grant? And are we gonna have to take that into consideration, or are they gonna go back to the previous pay once that grant runs out? And yeah, so I mean, I think these are some of the things that really worry me, because I mean, grants are temporary, you know, and taxing our levy is, you know, more permanent. So, you know, those are the types of things that I worry about. I'm not saying, you know, our employees, you know, don't, you know, deserve these type of things, but I'm trying to come at it from a fiscal standpoint too.
Yeah.
So,
And my understanding was those factors are carrying into 2024, because I kind of asked the same question when I was talking to the department heads. After that, then it would become part of budgeting for 2025 in the next.
so then it would be put it back on the levy, which will make our decision a little bit tougher, because once it goes on the levy, it hardly ever comes off. So I mean, yeah.
Okay, any other questions? Okay. All in favor, no
We need a
motion.
motion.
Yeah, I need a motion. Yep.
I'll make the motion that we approve the human resources approval of job evaluation ratings as presented.
Second,
Mr. Chair, I'll second with the maybe with an amendment that, you know, we, you know, maybe have some discussions in regards to this type of thing, you know, within the next year, hopefully before even the next budget cycle. So. No, I don't think so, but I want to make my point. You know? Yeah,
that's it.
Yeah.
Yeah. So I think we need to make sure it's clear.
Yeah.
It's either,
Yeah, there is no amendment
No,
needed.
no amendment. Yep.
okay. Any more discussion? All in favor, say aye.
Aye.
Opposed? Thank you, Ann. All right, then we have, I believe it's the administrator's report.
Thank you, Mr. Chair. Commissioners, I have a brief report for you this evening. I'll start off with the jail project, construction manager at risk request for proposals. We did publish the jail project CMAR RFP last Friday. I think I did send that to you in email so that you have a copy of it in case you get asked or anybody has an interest in seeing that. We also published it in the newspaper on Sunday, and it will also publish for the next 2 Sundays as well. So it'll be 3 full weeks of publishing. And then we did send it to 10 firms that we were aware of that were interested or expressed an interest or asked questions about that. So I imagine we should have a pretty good showing of some pretty strong firms that express interest in that. All responses are due by December 11th, just so you know. And we do hope to have a short list that's developed where we'll invite folks to come in and interview with us. That short list we hope will be done by about December 15th. And then we'll continue the process after that. Just quickly on legislative priorities, we are putting the finishing touches on that list. We'll be taking it to the management team here pretty soon for them to evaluate it. And then I plan to bring that to you for your first discussion on December the 12th at the board meeting. Also, we are working on distributing service awards. These are the annual service awards that we typically do every year for the staff. We will be doing that during the week of December the 4th. So that's coming up here in short order. Just a couple important dates I want you to just be aware of. The county, of course, will observe Thanksgiving holiday on Thursday, the 23rd and Friday, the 24th. So offices will be closed. Just a reminder also that there's a chili cook-off that we'd love to have you attend as a United Way sponsorship, which will be Thursday, November 30th from 11:30 to 1:30. On December 8th, we are having our all-day Moose Lake Jail tour for select jail committee members. If you're also interested, let me know. And if we have a quorum, I'll need to publish that in advance. But this is to go look at the sweat lodge at the Moose Lake facility. So if you are interested, please let me know. So that way, if I do get a quorum, I can get it properly noticed. Lastly, there will be no board meeting on December the 5th. Remember that meeting, because of the AMC conference, was moved to December 12th. And of course, that will be the meeting for the truth and taxation, the budget, all of that sort of stuff. So we'll have a couple of hearings that night. And then that will set us also up for back-to-back meetings on the 12th and the 19th, which will do it for the year for us. So that's all I have, but I'll stand for questions you might have.
Questions?
Mr. Chair, Tom, can you remind me of the dates for the Moose Lake tour?
Yes, that will be December the 8th, and it's intended to be an entire day. I believe
Okay.
that's a Friday.
And you need to get your
Background information.
background in.
Correct. Yeah, the background information should have been already submitted. If not, you still have some time, but we do want to get that in as soon as possible.
And this is open to the entire board, correct?
The board can attend if they'd like, and it's open to select members of the jail committee. So we didn't make it available for all. I mean, there's
Okay.
just space limited is
Okay.
all. So I think the design and operations team and a couple folks from the steering committee are intending to go. But certainly as a board, if you have an interest, I would encourage you to go as well.
Okay. And December 4th is the awards banquet or the awards or the week of?
Right. It's the week of the 4th. So what we
Okay.
do is we started this during COVID where we would try to limit gathering spaces, which we used to do before. We used to just have one giant, sort of award ceremony. We got away from that during COVID and started visiting with individual work groups. And it seems that they prefer that. So we've continued that sort of new tradition, if you will. And so there'll be about 5 or 6 different work groups that will be visiting throughout the week. Both Ann and I, typically the HR director and the county administrator, will do this along with the department head. And we'll just recognize the team. And it's also a nice opportunity to bring those work units together and recognize the whole unit. And so usually we pass out dilly bars and stuff like that. Just, a little bit
Okay,
of
yeah,
ice cream.
I remember that. I think I did it last year. And to be honest, I kind of miss, it being right here when we served, ice cream and floats. And I don't know what we all did, but I mean, I think it gave us an opportunity, I guess for myself, as a commissioner to really interact with, the people that really do the hard work, so if there is ever an opportunity for that to come back, I would be in support or favor. So the week of December 4th. Thank you.
Yes, thank you.
Okay. Thank you. Let's move on to legislative and lobbying issues along with the commissioner's report. And last time we started over here, so you have anything, Joe?
Thank you, Mr. Chair. Last Thursday at a KRLS board meeting, finalizing the budget. And we also did the director's evaluation. And she received high marks for the most part, and so she'll be continuing on with us at least for the short-term future, hopefully the long-term future. And one of the things that came out of that is that we're going to be looking at involving staff more in the director's evaluation, and not just board members. Also, I attended a Hope House board meeting last Wednesday, and we're kind of wrapping up our fundraiser. We had a fundraising goal of raising $4,300, and we surpassed that. We raised over $5,000 over the past week, so we're really happy about that. Help support folks in the community with their mental health needs. Let's see what else. There was a NACO committee meeting that I zoomed into. That was for any county commissioners that are in the central part of the United States. And so also I believe we haven't received the best advice from our private attorney, and the judge got the redistricting lawsuit wrong. So I would like to make a motion that we appeal the redistricting lawsuit.
Is there a second? Is there a second? Is there a second? Motion dies for lack of a second.
Mr. Chair.
Jim?
Commissioner Gould, I'm with you, on your thoughts and statements, in regards to the redistricting lawsuit, but I'm just not too sure. I guess I'm not in my time on the board here, starting to sound like somebody.
You're gonna be a veteran. Old guy?
I just don't know if we've ever made any motions during, our commissioners' reports and whatnot, and I guess I'm looking for,
Mr. Chair, point of information, I don't think it's illegal to do that. Anytime a board member has the floor during the meeting, you can make a motion.
I questioned that too, Tim, but I thought we hadn't adjourned yet, so let it go. I don't know, is there a protocol on that, Tom?
Well, the board has an agenda setting policy, and according to the policy that you approved a number of years ago, the board has to bring an agenda item forward to have it placed on the agenda. If it's controversial, then you guys get to vote on it before you get to talk about it. And then if you vote to include it, then you can include it at a future meeting, at which point then you can talk about it and then vote on it. So that's the policy that
I appreciate that input, because I think that's a much, we've always, especially, I know a couple of you have, if something pops up and you haven't had a chance to discuss it, you don't like that. You want it in advance. So probably it's a good practice just to not do that unless we've proposed it ahead of time.
That's been our past practice, and we've all experienced, I think, the downside of that. I brought an issue up before that you guys shot down and because of that rule. And so it's all happened to all of us, I think. Well, maybe not to John yet.
Okay. Anything else, Tim?
No, I don't know if he was done. It was just a question for Joe.
I guess I thought.
I'm
that-
good. You're on your
Oh,
report still.
okay, all right, thank you. So I know I missed my report last meeting, but I think I heard somebody starting their car, so I'll keep it short.
I think it's your wife.
Yeah, I think I hear her honking the horn out there. So last Monday, I was triple booked. I had 3 meetings. So I had the opioid meeting, CONCON meeting, and a NACO meeting. I had chat about you last Tuesday, last Wednesday, I had a CONCON meeting. Wednesday was the Northwest Juvenile Center meeting. Friday, I forgot about a lunch that I was supposed to be at. So that's my report for tonight. Thank you.
Okay, John.
Thank you, Mr. Chair. I just wanted to thank our HR director for putting up with me for 5 hours in the car, going to the Prime Health meeting last Thursday. Good job, Ann. And we got a chance to introduce our new HR director to the Prime Health Board, which is the part of Prime West that does our insurance for our employees. And so she was greeted very warmly by the groups.
Okay.
I'll let Craig talk about me.
Okay.
I'll let
And-
Craig talk about waste management. He likes to talk, so let's get.
Delegation here to the last guy. Had a Mississippi Headwaters Board meeting Friday, HRDC meeting Thursday night. Nothing super eventful to report on there in the interest of time. Airport Authority, we possibly have possibility of getting some 50-seat planes in instead of the bigger planes, but still having the first class, second class that Delta is requesting of SkyWest. And if that 50-seat plane is actually happens, then we'll be situated better because we won't have to deal with the security issues of having over that big of a plane. So that was good. I don't remember as far as the JASB board and the redistricting, that's still sitting with the state, and so far so good. There are the changes that we made in the, and not redistricting, but the rezoning, I should say, of the areas for the airport landing zone, and crash zones areas that we adjusted. They're still moving forward, and we'll hopefully have a public hearing, I would guess, probably early in the beginning of 24 January for that. Had a fair board meeting last night. I did inform the fair board that we were not doing anything with the development fund grant at this time, and that we were waiting to see what we have for actual monies available, and that we would revisit it in probably January. And so they're not counting on anything. They're still just going to hope to possibly get some money there. We had a solid waste committee meeting, as the chair mentioned earlier, this morning. Unfortunately, the MPCA has changed our application for the 9-county hub and spoke program. They removed our hubs from that, said they wouldn't fund the actual landfills for the line landfills. They're saying that we got to close our unlined landfills, but they won't fund the line landfills. So it's just really unfortunate that we've got a few different alternatives that we're going directly with the MMB, which we actually did send into proposals, and MPCA changed our proposal, then sent it to the MMB. So now they got 2 different proposals from us instead of the current one. So it's a little annoying and unnerving that the MPCA is not, we're trying to do the right thing, and we did the study and kind of coming up with this plan to make things better, and they're just seeming to stand up against it more often than they should. That's it. What's that?
Sounds like the Department of Corrections.
Oh, yeah. So that's my report. Thank you.
Okay. And I guess the one thing I just want to highlight is had an opportunity to attend the management team. And I'm always impressed with the quality of people that we have in our departments. And so this was no exception this time. I think if you get a chance, go meet the folks. And if you have questions of their department, talk to them. And I think that might help answer some of the questions we have as we go along. So with that, do I hear a motion to adjourn?
Mr.
Oh,
Chair,
Tim,
I remembered.
remember that honk back there.
So, and, do we have access to like the the pay grade scale and things like that, the steps? Could that be something that we can,
Tom can get
yeah,
that for
can
you.
email to
Yep,
us?
absolutely. We can
Alright.
get that to you right away.
All right, thank you.
All right. Now we have a motion. All right, we haven't had a mo.
Yeah, I'll make the motion to adjourn.
I'll second it.
All in favor, say aye.
Aye.
Opposed? So moved.